Good evening and welcome to our another discussion through AIAS Facebook platform. And today's discussion is related with one of the most important organ in our body, which we call as heart. Even though every organ has its own importance, but then when we talk about heart, which is one of the most significant organ, which look after all other our organ by providing them the nourishment and the blood. But then question comes up, if we don't look after our heart, what kind of problems comes up? On a simple level, if we have to understand, which is a very common sort of situation, that a simple high blood pressure is one very common and easily many of us can get affected, especially in today's world where our lifestyle, where our eating habits and mental and emotional factors are getting out of hand and some impact comes up. So when we talk about blood pressure, what exactly blood pressure is and how it happens, and then what we do from our Western medicine. So it's all about, as we know, heart is always pumping, and pumping is the blood, and that goes through our arteries. So when the pressure starts getting built up in the arteries from the blood, which can happen due to various reasons, and because 99% time as a general public, we are not concerned that why it happened, and we always try to look at, okay, my blood pressure is getting a bit higher, which will give you some kind of indicators, headache, a bit of sleep issues, and feeling quite hot, and all those sort of, even dizziness start happening, and then you will visit your GP. And once the GP has checked your blood pressure, he or she is going to prescribe you the medicine. And the first medicine, they definitely will ask you about your salt intake or how your factors are, and then you might be advised some diuretic. Diuretics are again to take excess pressure from the artery. That's the first component. But then if that is not happening, one of the most common medicine what being prescribed by every GP is our beta blockers. So beta blockers again are putting in a kind of barrier to not let the pressure build up in our arteries, and you will find that I'm doing fine, my blood pressure is under control. But then at the same time, there are so many other products also. So we have an ACE inhibitors, and then we have alpha blockers, and all these are the different gradation, but the focus is same, that how the pressure in your arteries can be minimized. But now again, if you see, on one hand you got the blood pressure, perfect. Then what they are doing is they're giving you beta blocker. It means they are putting some kind of pressure, right? So when that pressure is exerted to minimize the pressure on the, or blockages are being done to minimize the pressure in your artery, that process is actually hampering a normal process, normal flow of the blood. And somehow when you put in some kind of blockages, something has to go backward, and backward it goes toward the different other part of the body, and the most important is your brain, and that's where certain other complications will come up. So in those situations, yes, I got blood pressure, I got my beta blockers or some other kind of medicine based on what my GP has prescribed, and I'm feeling fine because they will advise you weekly you should get your blood pressure checked and all that part, and you feel perfectly fine. But then somehow with the discussion with the friends, family member, and everyone will then try to advise you, or you becoming more and more aware in yourself, and that at least I should use some kind of a supplement to support my heart. And so far, what kind of supplement someone will be looking for, even if you visit your naturopath or different kind of other practitioner away from the mainstream, they will be advising you different kind of enzymes, which might be CoQ10 is a very common sort of enzyme. Then you might be advised omega-3 kind of antioxidant sort of product, and then there are some other kind of products. Are so many products out in the market, and if you look at those products, and the reason, first of all, you all need to ask yourself why for so many years, because since the concept of using supplement has come up in our life, supplement means you are trying to supplement some kind of function, some kind of sign and symptoms which are developing in your body and which cannot be taken care by bodily intelligence. You will require those kind of supplements. And hence, these supplements get used. No one will even question those practitioners who are advising them those kind of product, that what exactly they do. And if you look at a little bit more in detail to them, because some people will be doing their own homework, and they will find that they are actually doing the same sort of thing. They are trying to minimize their blood pressure, they are trying to minimize the high cholesterol which can get built up in their arteries, which is creating more pressure. But then that kind of products are not actually doing any good to you, because as you have taken beta blocker or AC blockers or inhibitors, they are doing the same job for you and putting a lot of pressure on your heart and brain and other organs. And question comes up that we are using these kind of products for so long, so what and why we should discuss them now. One thing you all need to understand, that because for the last 50 years or so, people in the whole world, whether we talk about Western world or the other countries, were bombarded by these kind of so-called supplements, because everyone understands that Western medicine is not really helping to correct my core cause. And then these supplements are being introduced for various kind of problems or organ, and the heart is what we are talking today. So they were the reason of being prescribed to you, or you go to a health shop and pick up that product, or your practitioner prescribe you and keep using them without thinking that what a benefit this product is doing to me. And then the second thing comes up, at that time, neither the practitioner, neither the, whether we talk about our integrated medical practitioner, functional medicine practitioner, naturopath, herbalist, no one was having any understanding that are there such products which can really being used by our client. Because if at the end of the day, as a practitioner, You have done whatever qualification you are taking and sitting out in the market as a practitioner. Your focus is to help and support your client, and you would like to support them in a best way. And then when your knowledge is limited, I'm not again judging anyone, I'm talking about because the selection what we make as a practitioner or we make as a selection as a client who is suffering from high blood pressure, you are looking for such products which are just giving you symptomatic solution. And the reason behind that was, which I'm trying to share today, is that lack of knowledge, lack of understanding that there are such product which we call as herbs, but again not cosmetic herbs, what normally we use in our Western herbalism part. I'm talking about one system which is known as Ayurvedic medicine, and which is with us, with human beings for the last 5,000 years ago. And those herbs has been used in centuries for supporting our different organ, and by using them correcting the core cause which is leading to the problems. And here we talk about high blood pressure, but then there are so many other issues can come up in the heart, which is myocardial infarctions and other atherosclerosis issues, ischemic heart diseases can come up. So all those sort of problems which can happen, lot of mental, neurological disorders can happen. So these ancient scientists have advised and discovered and given to the mankind those kind of herbal preparations to use for in case if you got your heart issue or something, because today's focus is on the heart, so just focus on that. And because even at that time there were people who were never concerned to make any changes in their lifestyle, lot of mental emotional factor can come up because they are not able to handle all the issues what come across with them in their life, emotional issues, mental issues, suppressed emotions, and they're trying to mask the symptom at that time. But then their advice through their various practitioners was to start using such of these Ayurvedic herbs. But because these Ayurvedic herbs were never used in the Western world for many reasons. And one of the main reasons is, which is again created in a big myth in the Western world due to people's practitioners, their own agendas and on their interests, that Ayurvedic herbs are toxic, Ayurvedic herbs are having heavy metals, Ayurvedic herbs does not work, their authenticity, their quality controls are not there. And that was a biggest marker even with the medical doctors, and they will never. But then for the last 20 years, scenario has changed. A lot of research has happened in various such herbs, and those herbs has been found in the labs even now, that they have so much of a specific action which can correct that particular organ and help people to remedy or to support their heart or different organ by correcting the imbalances which are happening. And then another point to share with you, that these Ayurvedic herbs are not used single herbs, which is again in a dilemma presently the whole world is going through, because a lot of herbal companies, whatever we talk about, big companies or small company, they are understanding the importance of now Ayurvedic herbs, and they very much know that the supplement what they bringing in the market for last 50 years actually not doing any good, and to some extent public is interested to look at that, is there any other option, and hence these Ayurvedic herbal preparations are in the form of those capsules or tablet are coming up in the market. But when they try to bring these kind of herbs and introduce them to the public, and as we know, old habit is very difficult to change. They will still pick up one herb or the other and then still incorporating different kind of enzymes or vitamins and omega to make a new product, because their focus is to just bring something new so that at least another 10 years their business can carry on. But saying so, and it's in a reality, I have no hesitation in saying that, because this is what evidence are all there that what exactly coming up in the market. But whereas in Ayurveda we always talk about that Ayurvedic herbs will never work as a single herb. They always work with the synergy of the herbs. And hence in our ancient text, which we call as Ayurvedic pharmacopoeia and pharmacology part, a lot of such herbs has been well documented by these ancient scientists, which, as I mentioned, are getting very, very well proven now in our Western world through all the researches. And those products are now coming out in the market to support public, so that if you're having a heart issue, if you're having a simple blood pressure, or you are getting more complex issue or cholesterol or atherosclerosis or ischemic heart disease or other things which I mentioned, then what you need to look at is what are the best products to support my heart. Because at the end of the day, your health is in your hand, and you need to look at something which can be really supporting you and helping you to minimize the dependency on these antihypertensive drugs which has been prescribed by your doctor. And again, if this message goes to whatever level it can go, to 1,000 people or 10,000 or 100,000 people who are suffering from blood pressure, even one single person, if they can contact me and let me know that whatever has been prescribed to me by my GP or a consultant or heart specialist, that dosages or that medicine has ever been reduced by those specialists or practitioners, I will be very happy to have a discussion and accept that I am on the wrong path. But in my last 45 years of practice, I have not seen even one single patient whose prescription, what has been given to them by those doctors and practitioners, have ever get reduced. It's always keep increasing. And that's where I'm coming up with a message to all of you that now you don't need to suffer from such problem, and if you have a heart issue, you should alongside use these Ayurvedic formulation. And again, to mitigate your fear and the questions you all have, that how about the quality, how about the efficacy, how about the authenticity of those herbs, and how the heavy metals issue, which our Western doctors always talk about, how it can be mitigated. For that, I'm sharing with you that now I hope whether if you are in Australia or in New Zealand or in other part of the world, you must have heard of TGA. TGA is one of the regulatory body in this Australasia area, where they regulate and where they stand for the quality and authenticity and the efficacy of those formulations, whatever is being given out in the market. And on the same basis, certain such product has come up. Now the one product which I'm going to talk today is this heart sport Carditone product from the Ayurveda brand has come out in the market. Now this product has a license number from the TGA, which means this product is made in Australia under the clear guidelines of TGA. These products are made in the TGA regulated GMP certified companies, not made in India, not made by the Ayurvedic company on its own. It is an independent product made by a third party for the formulation which has been formulated by me, because that is where I was keep working for last 45 years. I have used these herbs in combination, and now when able to put those products through the TGA regulated companies, we were able to bring that, because the purpose and the objective behind that is to give an option, give an alternative to those people who are suffering for the last 50 years and supporting their heart by such product which does not do any good, and they have to become a slave of such product. If you are going to look into this product now, you will find your dependency on the Western medicine which has been given by your doctor will start reducing, and then you will start feeling much better. It will not have any impact on your other organ. Now, how this product works and what exactly in this product? There is one of the prime herb in Ayurveda we call as Terminalia Arjuna, which is known for its very effective role in supporting the heart function, and also mitigating the core cause why the blood pressure is building. As I mentioned, it's all due to our erratic lifestyle. And now again in Ayurvedic principle we talk about that these herbs work in relation to the impact what they have on the three bodily intelligence. But because in our Western herbalism or the medical doctors, they don't understand about the Ayurvedic principle, so their focus is on relying on the active chemical constitution, what we call as phytochemicals. And because this each herb has those such components, like we talk about Arjuna, it also have flavonoids and polyphenols, tannin and arjunic acid and gallic acid, which has been well proven as a maximum role in correcting acting as an anti-inflammatory, antioxidant, and also countering the hyperlipidemic conditions. It's well proven now with the clinical trials as a cardioprotective. So on same lines, what Ayurveda has been talking for centuries, right? These effects of this particular herb are coming up. Then there is another herb which I mentioned, that no Ayurvedic formulation will be without the certain combination of herbs which will affect your heart or other organs, what we're talking about. Then there is another herb in this one known as Benicassa hispedia, which is known again for its best neurological disorders impact, because again heart will always get affected by your brain. So then it also has a very supportive role in the kidney. Kidneys, again, if you look at what the role of the kidney in the high blood pressure, as I mentioned, the first medicine which you will be prescribed by your GP is diuretic, means to flush out, and the kidneys are known for the flushing out all the toxins which can build up and lead to the problem. And then it is a very, very specific cardioprotective function it has been worked out. And then it has a big role in the gastrointestinal effect, because again, now all of you are very much well aware that even in our Western medicine, it has been well proven that all our problems start from the gut, where all the built-up of the toxins start up. So these things has been well established, well known by these ancient scientists, and they have given now these herbs from centuries. But what little role I am playing is bringing these herbs now in a more specific way where public can trust them, because public trust these TGAs related to any product in this part of the world, or even in the USA where the FDA part comes up. FDA and TGA goes hand to hand, and much more effective role TGA play there. So that part of this particular herb has been very, very well established of the Benicassa hispedia. And then we have another herb known as our Indula racemosus. Indula racemosus is another Ayurvedic herb which has been known for its role in the ischemic heart diseases, high blood pressure, and act as an antioxidant. Then comes another herb known as Bicopia. Bicopia again is a very common Ayurvedic herb which has been now accepted and received by all Western doctors and naturopaths or so, which is known as Brahmi, and Brahmi's role is very much specific in the brain function. And because, as I mentioned, a lot of mental and emotional factors play in a huge role, whether it is your stress, whether it is your anxiety, whether it is your worry, panic attack, sleep issues, they will impact on your heart. And hence the role of the Bicopia is in a great in this product. Then comes one household herb which is known as garlic. Every one of us know about the garlic, but they don't really understand what is the value and what is the importance of this garlic is in relation to its medicine. Garlic is known as the best herb to minimize your cholesterol in your day-to-day life when it is building up in your arteries, and then improving the gut function from where the problem comes up. It has a very active constituent, and one of them is the alpicon compound, which comes from the garlic, and it has that ability to clean up the arteries. That is where its main role is. And then its another function is in relation to the high blood pressure part, because it helps to mitigate the pressure in the arteries. So simple herb, but so complex its role, which is not known and getting known to the Western world now. But this will never work on its own. That's one thing you need to know, because many of you will say, oh yes, we have a garlic tablet out in the market, we can use it. Of no use. If you are looking for something for your heart, something for your cholesterol and high blood pressure, or some myocardial infections, or even the heart functions are getting, tachycardia is coming up, and atrial fibrillation is coming up. In all those conditions, these herbs are not going to work on their own. They have to be combined. And then another very important aspect which Ayurvedic scientists has given them, that each herb will work based on the dosages. If you are going to use, whether you are using Terminalia, Arjuna, or Bicopia, or garlic, or Benicassa hispedia, or Inula racemosus, in small dosages, which is not the prescribed dosages, you might have all the herbs, but they will be of no use. Hence, you have to use that prescribed dosages. So, for example, if I give you Terminalia Arjuna will never work less than 2 grams in a single dose. And this is where you will see this product has 2 grams of that Arjuna in that one capsule of 500 milligram in a complex form. Then we have this, as I mentioned, the garlic, which is 200 milligram minimum has to be used. Same way, your Bicopia and Benicassa and Inula racemosus. One of the other herb which it has is known as Punarnarva, which is known as Boiravia diffusa. Again, its role is to expel the excess water, which is working again on your kidney. So you can see how complex this formulation is. So what else we need? It need to be decided by all of you who have a heart issue, that do you want to use these enzymes or omega-3 or 6 and having that pseudo satisfaction that I am supporting my heart, or you want to use a product which has specific herbs and then in the specific dosages combined together so that they can work with the synergy of each herb to give you a very complex, very effective support, a shield for your heart. And that's what you should look for. You have not used it for so many years, 50 years, 40 years, 30 years. Reason is you were not made aware of such product. And now the time is coming up, such Ayurvedic herbs in such ways where they are being used in a complex way and made under the right kind of companies, GMP certified companies, to give you that peace of mind, authenticity, efficacy, and then the quality control. Whereas the formulations role, I can give you my personal guarantee of 45 years that this product has a wonderful impact. Once you start using it for your heart issue, you will never get any more complexity in your heart, or you will always find that you are not required to increase your dosages of what your practitioner, as a medical practitioner, has prescribed. Thanks everyone, and we will catch up next time. Thank you.